The next bill I was faced with was the health care reform bill as a new member of Congress. And you know, and I'll just give you the bottom line, because I'm sure you have seen this bill, you've heard so much about it, but there's a fundamental difference in how we all want to reform our healthcare system. We all want to make it better. But the fundamental difference was this bill was moving in and creating a government takeover of our healthcare system. And there are those who believe that that's how you fix the healthcare system in the United States. I disagree with them. And my father was a physician, my mother was a nurse. I'm a strong believer in individual choices, protecting that doctor-patient relationship. When you go to your doctor, that you be able to choose what treatment you have for you and your family and make those decisions with your doctor. I talk to working families out there that are struggling to make it from paycheck to paycheck. Small businesses, maybe some in this room, they're just struggling to make it from payroll to payroll. Many of you have called our offices about different circumstances. And I believe we should have been focused on helping to reduce the cost of health care, to make it more affordable for hardworking families, to make it more affordable for our small businesses to be able to offer their employees. And there's a whole lot of different ways that were proposed on our side of the aisle on how to do that. And this process became very partisan. It became very contentious. The American people, I was hearing from my district, no matter what county I went into, and I represent 8 counties, was we don't want a public option or a government option. All the way to the point to the end where I asked them, you know, where's the intensity? Where is the that we need right at the end? And they said, what part of no didn't you understand? We said every way we could, as loud as we could. And to force a bill through using parliamentary gimmicks, reconciliation, and other things to get a bill through and to get the votes passed, I think is a bad process. And the process itself, this 1 year, just dealing with these bills, that I saw as a freshman, got to the point where it was so frustrating that as a freshman class, we stood up and had 2 national press conferences. One on being able to read a bill before we vote on it. The stimulus bill, a 1,000-page bill, and one member of Congress had an opportunity to read that bill before we voted on it. That was supposed to turn our entire economy around. We didn't have a chance to read it in Congress. And we pushed hard that we have at least 72 hours to go read a bill, that when it's in committee, it be put online so the American people can see that bill and know what we're debating, and have full transparency. We then had a second conference during the health care debate when political gimmicks were being used to try to pass this bill in the House. One was called Demon Pass. I had never heard of it before, to be honest with you. But it was literally passing a bill without having to vote on it, which, you know, I go out and I visit a lot of our schools in the district, and I talk to the classes, and we talk about how a bill becomes law. And one of the most common responses I get from our students is, well, you have to vote on it, pass a bill, and then it becomes law. And they are absolutely right. It's very clear, I think, in our Constitution. This gimmick allows you to pass a bill without even voting on knowing what you're voting on. They pulled away from that gimmick. They didn't use that. What they used was the Supermax deal where no amendments were being added, and whatever the bill was, we had to vote on it. And there was very limited debate on it. But I do think we can improve the health care reform bill. I think right now there's a lot of uncertainty as to how it impacts folks. Our office has been working with many, I look across this room, some of you in this room, many of our businesses, many of our organizations to try to determine how it's will impact them. And so as we go through this process, we certainly want to try to be helpful to you, and I think there's ways that we can improve on this bill. And I know on our side of the aisle, certainly would like to see some improvements. We'd like to see malpractice tort reform put in there to help lower costs. We'd like to see you being able to shop for insurance nationally, not within our state or region, but to have more competition to be able to choose your policy. As a group, as an organization, be able to pull together with other groups and lower your group rates. Using HIT technology, healthcare information technology, to lower rates. I mean, I talked to a group of doctors, and a couple of them had went paperless. They began using, just the internet and the computer, and they were able to reduce costs significantly. That they've been able to pass on some of that cost savings to their patients. I introduced one of those. We introduced a series of bills to take a step-by-step approach. I introduced one of those bills to expand the HSAs. I don't know how many of you as small business owners offer your employees HSAs, health savings accounts, or flexible medical savings accounts. My bill expanded that. It will allow, for example, the employer can deduct their portion, the employee can deduct theirs as well, and give them an incentive to want to invest in that. It expanded it out to the spouses to be able to be included in that. This bill that passed puts parameters on that, and is very, I mean, there's no incentive for the HSA. It takes away the high deductibles, and it's going to limit, I think it's going to take things the other way.